Ever feel like you just need the key facts fast? Today, we're doing just that. We're diving into something you might not think about often. What happens when animals, like pets, get into illicit or club drugs?
Yeah, it's sort of a hidden aspect of household dangers and the physiological effects. They can be really intense, sometimes quite alarming.
Covering quite a range, right? Everything from barbiturates, benzos.
Cocaine, GHB, LSD, marijuana, MDMA, meth, opioids, even PCP. It's a broad spectrum.
Exactly. So our mission here is simple. Distill the crucial info, the veterinary perspective on these toxicities, what really matters.
Okay, so biologically speaking, how does this stuff actually start affecting an animal? Where does it begin?
Well, the key thing to grasp is that pretty much all these drugs go for the central nervous system, the CNS.
The CNS, the body's main control center, basically.
That's right. It runs everything, breathing, movement, mood. And these drugs, they interfere with that control center. They mess with the chemical messengers in the brain, the neurotransmitters. Each drug class does it in its own specific way. Neurotransmitters, those brain signals. So the drugs disrupt the communication.
Precisely.
Okay, let's take barbiturates first. What's their mechanism? How do they work?
Barbiturates are basically CNS depressants. They just dampen brain activity. That's also why they can work as anticonvulsants, stopping seizures.
Okay, so they slow things down. What about cocaine? That seems like the opposite.
Oh, completely opposite. Cocaine causes this big release of norepinephrine, serotonin, and dopamine. Think of them as like the brain's natural uppers. So cocaine just slams the accelerator on those, and it hits the heart hard too, stimulates the cardiovascular system.
Wow, okay. A triple whammy for the brain and heart.
Right.
GHB, that sounds different again.
It is. GHB is like a synthetic version of GABA. GABA is a natural brain chemical that calms things down. So GHB also causes CNS depression like barbiturates, but through a different route, mimicking GABA.
Got it. And then LSD, famous for hallucinations.
Right. LSD stimulates the CNS and causes hallucinations. It mainly boosts serotonin and glutamate, but it also plays around with dopamine and adrenergic receptors, so it's pretty complex.
Okay. And marijuana, how does that fit in?
Marijuana is interesting. It binds to specific cannabinoid receptors all over the CNS, and because these receptors influence so many other neurotransmitters, dopamine, GABA, histamine, serotonin, norepinephrine, prostaglandins, the effect can be really variable, sometimes sedation, sometimes agitation. It's not always predictable.
Huh. The variability is key, so you can't just assume one reaction. What about MDMA? Ecstasy.
MDMA ramps up serotonin levels dramatically, also catecholamines and dopamine. So you get this intense CNS stimulation plus hallucinogenic effects. Kind of like LSD, but often, frankly, more severe.
More severe, okay. And opioids. We hear a lot about those.
Opioids are classic CNS depressants. They bind to specific opioid receptors in the brain and spinal cord. That reduces pain, but it also slows down other body functions, sometimes dangerously so.
Right. Lastly, PCP. Known for causing unpredictable behavior.
Yeah, PCP is definitely a wild card. It blocks glutamate, which normally excites brain cells, but also boosts norepinephrine, epinephrine, and serotonin. So it acts like a stimulant, mimicking the fight-or-flight response, and a hallucinogen. Leads to really erratic signs.
Okay, so a whole bunch of different brain actions. What does this look like on the outside? What systems get hit hardest?
Well, the impact really spreads out. If we look system by system, let's start with cardiovascular and the heart and blood vessels. A lot of these cocaine, GHB, LSD, MDMA, meth, PCP, they can cause arrhythmias, irregular heartbeats, and hypertension, high blood pressure.
Okay, so speeding up the heart, raising pressure.
But then others like barbiturates, marijuana, opioids, they can also cause arrhythmias, but they tend to cause hypotension. Low blood pressure.
Ah, so opposite effects on pressure depending on the drug. That's a critical difference.
Absolutely. It really highlights the different ways they stress the cardiovascular system.
What about muscles? Any direct impact there?
Musculoskeletal. The main thing we see is tremors, muscle shaking, especially with cocaine and PCP.
Okay. And the nervous system overall, beyond the brain chemistry?
Yeah, we can kind of group the overall nervous system effects. Stimulants like cocaine, LSD, MDMA, they cause agitation, hyperactivity. Depressants like barbiturates and GHB. They cause sedation, lethargy, make the animal seem slow, unresponsive.
Makes sense.
Then you've got marijuana, opioids, PCP. These can be unpredictable, maybe sedation, maybe stimulation, and often you see ataxia with these. Lack of coordination, stumbling, wobbliness.
So clumsy and either hyper or zoned out. That sounds really concerning. What about the eyes? Any telltale signs?
Yes, the eyes can give clues. Cocaine, LSD, MDMA often cause mydriasis. dilated pupils, really wide.
Mydriasis.
Yeah.
Wide pupils. Okay.
But opioids typically cause the opposite, meiosis. Constricted pupils, very small, sometimes pinpoint.
Wow, such a small detail, but potentially very informative. Breathing. Is that affected?
It can be. It's a major concern, though maybe less frequent than other signs. Barbiturates and opioids can cause respiratory depression, basically slowing down or weakening the breathing. That's a potential emergency we always watch for.
Definitely sounds like an emergency. Okay, so let's crystallize this.
Right.
If someone suspects their pet got into something, what are the specific signs they should really watch for?
It really varies by drug, like we've been saying. For barbiturates, think sedation, sleepiness, though rarely agitation can happen. Also, ataxia, the stumbling, bradycardia, slow heart rate, hypotension, low blood pressure, and in bad cases, yes, respiratory depression, even coma.
Okay, and cocaine sounds like it would be more dramatic.
Usually, yes. Agitation, restlessness, hyperactivity, mydriasis, those dilated pupils, tachycardia, rapid heart rate, hypertension, high blood pressure, plus tremors and potentially seizures. It's often a very clear picture of overstimulation.
Right, quite distinct. GHB and opioids, what would an owner see?
GHB and opioids often look similar. Lethargy, weakness, maybe progressing to coma. And that respiratory depression we mentioned is a big risk for both.
Okay, LSD.
LSD, dilated pupils again, disorientation, maybe acting like they see things that aren't their hallucinations. Agitation is common, though sometimes sedation. Tachycardia, too.
Hallucinations. Hard to know for sure in an animal, but you might see strange behavior.
Exactly, reacting to nothing, tracking things, that sort of thing.
And marijuana, given that variability.
With marijuana, sedation is most common. But like I said, sometimes agitation, ataxia is very frequent, that drunk-like walk, hypotension, low blood pressure, coma in severe cases. The variability just makes it tricky sometimes.
MDMA sounds particularly dangerous from what you said earlier.
It can be, yes. Signs include intense agitation, mydriasis, hyperthermia, that's a dangerously high body temperature, tachycardia, tremors, possible hallucinations, seizures, and tragically, yes, MDMA toxicity can be fatal. It's very serious.
Definitely serious. And PCP, the unpredictable one.
PCP can range from depression and lethargy all the way to extreme agitation, even aggression. You might also see hypertension, tachycardia, tremors, and seizures. Its unpredictable nature is a real challenge.
So how does this usually happen? Where do animals encounter these drugs?
Mostly, it's accidental ingestion. In a home where someone uses these substances, maybe they aren't stored securely. Or maybe something gets dropped and the animal finds it. That's the most common scenario.
Okay.
We also see it sometimes with working dogs, like police dogs who might encounter drugs during searches. Those are the main routes of exposure.
Right. So if a vet suspects this, how do they confirm it? Is there a specific test?
Well, standard blood work like a CBC and chemistry panel and a regular urinalysis, they don't usually detect the drug itself, but they might show secondary effects, like if there are tremors, muscle enzymes like CK might be high, potassium could be up, we might see myoglobin in the urine from muscle damage.
So indirect clues from standard tests. What about those human drug test kits you can buy? Do they work on pets?
That's a good question. Those urine drug screens for humans can often detect many of these drugs in animal urine too. Barbiturates, benzos, cocaine, MDMA, meth, opioids, PCP. They're generally quite reliable, surprisingly. But there's a big exception, marijuana.
What's the issue with marijuana test?
They can give false negatives in animals. So a negative test doesn't reliably rule out marijuana exposure in a dog or cat. That's really important to know.
Definitely. Good caveat. Are there more definitive lab tests?
Yes, specialized tests like gas chromatography, mass spectrometry, GCMS. Human hospitals and diagnostic labs use these. They can identify the specific drug. But the problem is turnaround time. It can take too long when you need to treat the animal now, so they're more for confirmation later, or maybe legal cases.
So less useful in the immediate emergency.
Right. In the moment, the vet is also thinking about other things that could cause similar signs. Differential diagnoses.
Ruling other things out, like what? Can you give some examples?
Sure. If an animal is comatose or very lethargic, we'd think about brain infections, maybe meningitis, or liver disease causing brain issues, hepatic encephalopathy, or even other toxins like antifreeze or alcohol.
Okay.
If we see agitation, tachycardia, dilated pupils, like with cocaine, we might also consider, say, caffeine toxicity or certain slug baits like metaldehyde, or maybe MDMA.
And for LSD or PCP signs?
Yeah.
Hallucinogenic type stuff?
Could be confused with ketamine exposure, maybe psilocybin mushrooms, or again, MDMA. For marijuana science, the list is broad: other sedatives, stimulants, certain medications. And for suspected MDMA, again, brain infections, liver issues, other stimulants. It's a process of elimination based on signs, history, if we can get it, and maybe those urine screens.
Makes sense. It's detective work. So once drug toxicity is the top suspect, what's the treatment approach?
First and foremost, supportive care. Usually means inpatient care, keeping the animal in a dark, quiet, calm environment. Minimizing stimulation is really key because many of these drugs amp up the nervous system.
Right. Keeping things calm. What else?
Thermoregulation, managing body temperature. Some drugs cause dangerous overheating, hyperthermia, so cooling measures might be needed. 4V fluids are also critical. They help maintain blood pressure, hydration, and importantly protect the kidneys from damage if muscle breakdown is happening from tremors. Helps flesh out that myoglobin.
And if breathing is affected, that respiratory depression.
We monitor breathing very closely, rate and effort. If it gets too slow or shallow, especially with barbiturates or opioids, we might need to intubate, put in a breathing tube, and use a ventilator.
Okay. What about getting the drug out?
If the ingestion was very recent, like within an hour or two, and the animal isn't showing severe signs or vomiting yet, we might induce vomiting. Or for large ingestions, maybe gastric lavage, basically washing out the stomach, but that carries risks too.
Are there specific medications to counteract the drugs? Antidotes?
We have meds to manage symptoms, definitely. Activated charcoal is common. Given orally, it binds the drug in the gut, stops more absorption. Sometimes we add a cathartic, something to speed up bowel movements, to move the charcoal and drag through faster, especially if we expect severe signs.
Okay, charcoal. What about for agitation or seizures?
For agitation, we might use tranquilizers like acetpromazine or cyproheptadine. Dosages differ for dogs and cats. Cyproheptadine can even be given rectally in vomiting cats.
Rectally?
Yeah, it absorbs well. For more severe agitation or seizures, benzodiazepines like diazepam are often the go-to. We use methocarbamol, a muscle relaxant, for tremors. Propranolol, a beta blocker, can help control a dangerously fast heart rate.
And you mentioned a reversal agent?
Yes, for opioids, we have naloxone. It's a specific antidote, works very quickly to reverse opioid effects. A lifesaver in overdose situations.
That's great. There's a direct antidote for opioids. Now, you flagged a really important warning earlier about diazepam and MDMA. Can you repeat that?
Absolutely crucial point. We do not use diazepam for MDMA-induced agitation. Evidence suggests it can actually make things worse, increase the dysphoria, the distress, and potentially increase morbidity, even mortality. It's a definite contraindication.
Wow, okay. That's a critical detail for vets. So once treatment starts, what's the follow-up like? How long does recovery take?
We monitor them closely at first: blood pressure, heart rate, urine color, neurological status, checking frequently. As they stabilize, we monitor less often. The onset of signs is usually fast, minutes to maybe a couple of hours after ingestion. Prognosis is generally good with prompt, aggressive treatment. Most animals recover within 24 to 36 hours.
That's pretty quick, actually.
It usually is. The main exception can be marijuana. Its effects sometimes linger longer, occasionally up to 72 hours.
Okay, 24 to 72 hours. Good to know. So wrapping this up, what's the main takeaway for our listeners?
I think the bottom line is, yes, animals are definitely vulnerable to illicit and club drugs. The effects vary widely depending on the drug, ranging from sedation to severe agitation, impacting basically every body system. It's serious stuff.
And it really highlights the need for caution, right? If these substances are around, secure storage is just non-negotiable for pet safety.
Exactly. Awareness is key. And, considering how differently these drugs hit the nervous system, makes you wonder, what else might future research uncover? Potential effects in other species? Or what about chronic low-level exposure? What could that do?
That's definitely something to think about. A concerning but fascinating area.